Welcome to our blood collection procedure guide. In this video, we will walk you through the step-by-step process of collecting blood. Please note that this procedure should be performed only by trained medical professionals. Before starting, gather necessary equipment such as sterile needles, blood culture bottles, collection tubes, alcohol swabs, a tourniquet, gauze, tape, and a sharp container. Prior to interacting with the patient, follow hand hygiene protocols as per facility policies and guidelines. Inspect all equipment for defects and check expiration dates. Patient identification by entering the information into the facility's database. Verify the patient's full name, date of birth, gender, and proof of ID. Approach the patient with a friendly demeanor. Explain the procedure, ensuring they understand what will happen. Address any concerns they may have. Compare the information provided by the patient to the information on the test request or all sample labs. Ask the patient if they have any problems with blood draws or other complications related to blood specimen collection. Disinfect the rubber septum on the blood culture bottles or tubes with 70% alcohol and allow it to dry. The patient's arm should be positioned horizontally or slanting slightly downward on a suitable support with the arm extended to form a straight line from the shoulder to the wrist. Identify a suitable vein for blood collection. The preferred venipuncture site is the antecubital fossa. When antecubital veins are not acceptable or unavailable, veins on the back of the hand are also acceptable. For ease of vein palpation and specimen collection, the phlebotomist should apply a single tourniquet just above the area being assessed. Ask the patient to clench and hold the fist until blood flows into the collection device. Allow it to dry completely. Keep the needle in line with the vein and at an angle of 30 degrees or less. Release the tourniquet promptly once blood flow is established to minimize hem concentration, unless it is anticipated that doing so may result in vein collapse. Position the adapter cap onto the aerobic bottle and press down directly to puncture the septum. Keep the bottle upright below the draw sites level. Ensure that the bottle is appropriately filled to the fill-to mark or the designated fill level. After inoculating the aerobic bottle, replicate the process for the anaerobic bottle. Monitor the bottle volume and pull up the adapter to remove the needle from the stopper when the desired amount of blood has been added to the bottle. Attach the collection tube to the needle hub. Blood will flow into the tube due to vacuum pressure. Collect the required amount of blood according to the test orders. Maintain needle placement while advancing the tube using the flanges of the holder to stabilize the device. Once the tube is filled to its specified volume, detach the tube from the needle and gently mix it through inversion. The first required tube is a coagulation tube. Initially, collect a discard tube to prime the collection set tubing, ensuring proper anticoagulant to blood ratios. Remove the needle, place a clean gauze pad lightly, and apply pressure over the venipuncture site. Activate with one hand by holding the end of the safety shield using your thumb and index finger, while using the remaining fingers to securely grip the tubing in the palm of your hand. Discard contaminated needles in a suitable sharps container. Never cut, bend, break, or recap needles. Specimen tubes should be labeled promptly following the collection and in the presence of the patient. 1. Patient's first and last name. 2. Patient's specific identifier. 3. Collection date and time. 4. Identity of the person who collected the specimen. Verify the information on the label tubed is correct. Advise the patient to consult the doctor if any complications develop at the site of venipuncture. Appropriately labeled blood collection tubes must be sent to laboratories designated to perform the required testing procedures. Ensure the specimens are transported to the laboratory as soon as possible. Remove the gloves and perform hand hygiene. Thank you for watching our blood collection procedure guide. Remember, this procedure should only be conducted by trained healthcare professionals. If you have any doubts or concerns, consult with your medical supervisor. Stay tuned for more healthcare tutorials and guides.